This is WPSL Port St. Lucie, the talk of the Treasure Coast.
And a very pleasant good Monday morning. Welcome into Treasure Coast Health Week. We're live today, and we're got a busy show coming up for you for this hour here on 1590 WPSL. Yours truly, Charlie Neal. And always, Treasure Coast Health Week is brought to you by St. Lucie Medical Center, sponsoring the show for many, many years. We thank them for that as well, too. We have a couple of guests with us today, too. We're going to say hello to Jyric Sims, who's the Chief Operating Officer for St. Lucie Medical Center. And we'll be joined by Jim Kruger, who is Director of the Emergency Room Operations over at the Medical Center as well. So we're going to, lots going on. Things are happening, and so we're going to bring you up to date with what's going on at the St. Lucie Medical Center as well, too. But we're going to start with Jyric Sims, who is Chief Operating Officer. And Jyric, good morning and welcome to the show.
Good morning. Thank you very much.
Good. It's nice to have you with us for this morning here on the show as well. So we appreciate your coming by. I'm going to see if we have any. Okay, let's go here. Let's try this there. And we welcome you into the show. So
our pleasure.
There we go.
Thank you very much for having us.
Yeah.
No problem at all.
Good. And thank you very much. Now, we usually, I believe we've had this opportunity the first time to talk with you.
Right.
And we always like to get a little bio, tell the listeners a little bit about yourself and where you trained and how you ended up on the Treasure Coast.
You bet. Well, first off, let me tell you, it's a pleasure to be living on the Treasure Coast now. My wife and daughter and I moved to the Treasure Coast a little bit over a year and a half now. Mm-hmm. We moved from Houston, Texas.
Oh, okay.
So I was there at another HCA facility in the Clear Lake area in Houston. And so, with HCA, with kind of a larger company, typically as the hospital executives, they move us around kind of where their need is at. And there was an opening here at St. Lucie Medical Center for the Chief Operating Officer position, and it's been a pleasure ever since. So, and prior to Houston, I went to graduate school in Arkansas.
Okay.
As well. So I've kind of moved around a little bit. I'm originally from Louisiana, born in New Orleans and raised in Baton Rouge, Louisiana.
So Louisiana or is it Louisiana? Or take your pick.
Take your pick. It's kind of the tomato. Take your pick.
Well, I know the first thing you wanted to find out if there was a Popeyes before you came over there, so you get some of that Cajun cooking and
My
everything.
wife loves Popeyes. Absolutely. That's been a destination for us.
Yeah, I'll go. You got a Popeyes, we'll be there too. No, but no, actually coming from Houston though, that was your last stop.
It was
at thriving city. We have some good friends from Houston as well too, but I guess it gets really kind of hot and muggy during the summer here.
Yeah, it does, and I tell you, even though I lived 8 miles from my hospital, it took me probably 45 minutes to get to work.
Yeah.
So I don't miss the traffic. I certainly don't miss the mugginess, but nonetheless, Houston's a great city, but equally, Port St. Lucie has been very good to my wife and I.
Any golf or fishing in the?
Oh yeah, I'm an avid golfer. I wish my game was as good as my talk about it, but nonetheless, yeah, it's what a great area. Phenomenal.
Go out and have fun. That's what you do too, and of course you got a great selection here too. Jyric Sims, Chief Operating Officer with the St. Lucie Medical Center. What does your position entail now?
Sure. So as Chief Operating Officer, I'm over all of the operations of the hospital outside of the nursing. Mm-hmm. So when we think of in hospital speak, we call it ancillary services: radiology, lab, pharmacy, environmental services, food and nutrition. Our behavioral health unit, which is a 22-bed inpatient unit, wound care, hyperbarics, physical therapy, occupational therapy, speech therapy, those items. Yeah. But equally, I'm over all the staffing and overall building maintenance and code compliance of the hospital as well. So typically there's 4 executives in the hospital: the CEO, COO, the Chief Nursing Officer, and Chief Financial Officer. So we all work in tandem to kind of keep the operations running, keep the doctors happy, and keep our patients satisfied. So that's really what we strive to do.
What point in your life did you decide, hey, this is what I want to do?
Very good point. Out of high school, I became a certified nursing assistant.
Oh, okay.
So I worked in a nursing home for a couple years, and I always knew I wanted to be in healthcare and in working one-to-one with patients. I did an internship in 2003 at the Medical University of South Carolina in Charleston. phenomenal city as well.
Yeah,
and I worked directly there with the executive of MUSC, the Medical University of South Carolina. And from that point on, I was just fascinated by what he did, the patient's lives he touched, and just his overall professional demeanor. So that really kind of guided me towards hospital administration.
Okay, so you've been here for a little more than a year, you say?
A year and a half, absolutely.
So moving along and loving every minute to it. Okay, Jyric,
every minute.
Yeah, Jyric Sims. Now, you had a pretty good event going on last week, I guess, because of new additions and things like that happening at St. Lucie Medical Center.
Absolutely. We were very happy to have our ribbon cutting. We opened our newly renovated and expanded emergency room, which opened up to 35 private rooms. It increased about 16,000 square feet. Wow. Certainly, we got the 3-prong trauma rooms, and we got really the space, I think, that really now parallels the great quality of care that Jim and his team, along with Dr. Sass, our medical director, and the physicians provide as well. So we had over 120 people show up for the ribbon cutting, and I think the mayor as well as our Councilman Bowman was there, and all were just fascinated with the overall facility. So it was a great event.
Good. All right. Well, Jyric, thank you for that. And we don't want to ignore our other guest here, of course, a friend of the show here, Jim Kruger, who is heads up the emergency room operations. How you been, guy?
Good morning. Thank you. A little late this morning, but thanks for.
Well, that's okay. We keep your seat warm here for you, so that's okay too. You can move a little closer to the mic there too, if you could, Jim. Yeah. Anyway, Jim Kruger, and it's been a while since we've had a chance to visit with the Jim. But bring the folks up to date with who you are and how you came on the Treasure Coast.
I'm the Assistant Vice President of Nursing and over the Emergency Services at St. Lucie Medical Center. And as Jyric was talking about our recent final completion of the ER and some other construction that Jyric is leading out in at the hospital, providing care for our neighbors, and that's our plan this year as we outreach through several ways to reach all of our neighbors with positive health care. I'm not sure where Jyric has talked about yet, but I do want to speak about the senior ER approach to care. We've decided that we're surrounded by around 7 or 8 nursing homes and some private communities.
Right.
And we decided that we should focus on those VIPs, our senior citizens. So we've streamlined some triage processes, making it easier for the patient to get in. We've developed some silver ID bracelets that signify somebody being over the age of 62. We're doing things like hearing amplifiers, magnifiers, ball squeezers, larger remote controls, a little bit different lighting in the rooms, cubicle curtains that are a little more calming for the age group. Beds that are low to the ground, so they're not struggling to get up if they have to go to the restroom. Which
there has to be that right height of the bed. I'm beginning to see this in my life. Too low and you can't get up, or too high and whatever. But
and you fall. It's about 23 inches. So
okay,
we're working on that. Pocket cards that we're going to give them that have their medications and their allergies that they'll be laminated and they can carry in their pocket at all times. So no matter where they're at, if they're visiting their grandchildren in Arizona, they have it. If they're here in Florida, they have it, and it makes it a little easier to take care of them. We're also going to be helping them sign on to our patient portal, and that's where they have access to their medical record 24 hours, 7 days a week. So when they come in the emergency room or into the hospital, we'll be using people on our staff to sign them up on the portal, and they'll, again, have access to everything that they would have as if they were laying there in the medical records department reading it. So we're excited about that.
Great. Well, I know you couldn't be more pleased that you were able to expand your emergency room, because you don't make that call. The state does, and I know you've been trying to do that for some time, because, boy, when the season hits, then you start getting a situation with a lot of need for the emergency room, but you just don't seem to have enough room. But now you're breathing a little easier, right?
Absolutely. That's correct. And we're fortunate to be part of the HCA hospital system, and certainly they've actually invested over the last 18 months, including the development that we're going to talk about in a minute, well in excess of about $25 million into St. Lucie Medical Center. And our overall goal is to continue to customize the hospital to really match our patients' needs and also match their expectations expectations of us as well. One of the things I'm sure Jim was going to talk about is we have now, 16 residents, is that right?
That's correct.
We're actually a teaching hospital, so we're up to about 46 residents, 16 emergency medicine residents. We have 18 family practice residents, and we have about 16 to 18 of our traditional intern residents. So we're a teaching hospital, and again, we just continue to customize our services to really match our patients' needs and expectations.
Yeah, good.
Yeah, this year we were able to hire one of the residents as she graduated, so hopefully they're listening in the emergency room. And Dr. Fowles, welcome aboard. So we're happy to have her. It's a real great addition to the staff.
Great team.
Okay, good. All right, we're enjoying time here on Treasure Coast Health Week this morning with Chief Operating Officer Jyric Sims, and also with Jim Kruger, our friend, Assistant Vice President for Nursing. There we go. Okay, we'll get it right. That's a new title.
Relatively new title.
Yeah, okay. Very good. Congratulations, too. We're going to take a time out and hear from St. Lucie Medical Center, and then we'll continue our conversation on Treasure Coast Health Week. Stay with us. The Orthopedic and Spine Institute at St. Lucie Medical Center offers high-quality orthopedic care delivered in a unique environment that feels more like an upscale hotel than a hospital floor. Each of the 35 private rooms features state-of-the-art safety and monitoring systems and orthopedic equipment. Expert orthopedic physicians perform a full range of spine and orthopedic surgeries that help patients regain independence and get back to a healthy and active lifestyle. For more information, call us at 1-800-449-8345.
St. Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, and orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you. St. Lucie Medical Center is part of the Treasure Coast healthcare system that has been providing services for over 30 years. Their 229-bed hospital has grown with the community, ensuring access to the latest in technology and medical expertise. Services include emergency care, obstetrics, robotic surgery, and orthopedic and spine institute, behavioral health, and an extensive rehabilitation program. With over 250 physicians covering 41 specialties, St. Lucie Medical Center is here for you.
High-quality rehabilitation services for individuals recovering from an accident, illness, or surgery is a top priority at St. Lucie Medical Center. Our rehabilitation team of physical, occupational, and speech therapists are specially trained to help patients achieve mobility and daily living activities. Whether as an inpatient or through our newly renovated outpatient rehabilitation center, count on us for the best in rehabilitation services, lymphedema treatments, and advanced wound care therapies. For more information, call 1-800-449-8345. And welcome back to Treasure Coast Health Week on this Monday. Yours truly, Charlie Neal. Treasure Coast Health Week brought to you by St. Lucie Medical Center. And again, appreciate their sponsorship always of the program. Jyric Sims is with us today, Chief Operating Officer, and our friend Jim Kruger, the Assistant Vice President for Nursing for St. Lucie Medical Center, joining us this morning because they've had some big doings going over there. New expansion of the emergency room, but wait, there is more that we're going to elaborate on for the next few minutes, too. And so bring us up to speed on that, Jyric.
Actually happy and proud at the same time at the ribbon cutting to announce to the public, our board, to our physicians, and really to the community that we're going to be expanding. We're going to be expanding to the Darwin Square area, a freestanding emergency center, or emergency room, I should say. It's going to be staffed with board-certified physicians. It's going to have separated pediatric treatment and waiting rooms from adult as well. It's going to have a full-scale laboratory on site, as well as CT and X-ray radiology capabilities as well, 24/7, 7 days a week. So if I can kind of orient you a little bit, if you think about the corner of Darwin and Port St. Lucie Boulevard, the plot of land that we're going to build on is just east of the McDonald's in that Publix shopping area as well. Again, a 24/7 emergency room there at Darwin Square. And the whole goal there is we have many of our patients that live in that area who have their treating physician at our hospital. This is an outstanding way for us to connect, or reconnect, I should say, with the patients of that market. Overall goal is to drive down wait times and get patients to physicians in a short amount of time to get them the treatment that they need.
It always occurs to me, too, you're pretty accessible, too, from the Turnpike and the interstate now in case of emergencies on Becker Road, because that's not too far away.
It's not too far away at all, absolutely.
Yeah,
that's very correct. And, we're trying to bring that care out to the neighborhood. And by locating the freestanding emergency department out there, it'll be one way to have the hospital right there in their own backyard in those neighborhoods, kind of shortening the drive a little bit. But like Jyric said, it'll be divided into a pediatric section and an adult section. We'll try not to mix the two. And I think that's really good for the mom and dad who are bringing the kid in with a sore throat, or he's got a twisted ankle and he's crying, and the other side maybe has some adults who are not feeling well, to kind of keep that mixture from happening. But a lot of people want to know what a 24/7 freestanding ER is, and I think we just need to let them know that that's exactly what it is. All the service capabilities, CT scan, laboratory, everything that would be at our hospital is going to be in that freestanding ED.
Yeah, what's the timeline?
Where we're currently we're going through permitting, so we're thinking early to mid-summer of next year we'll be fully operational and open to the public.
Okay, so again, more accessibility to St. Lucie Medical Center now with Darwin Square on the radar screen right now, and we'll be up and running in a little more than a year, too, so that'll work out. So staffing, I guess you're going to need a few people out there, aren't you?
Yes.
So you got to make room for some nurses, doctors, and everything else, right?
Absolutely. And even before we get to that point, certainly we're going to be using all local labor to help us get the facility up and running. But about 43 projected individuals to be working around there year round. So we're going to be staffing up to do it. So more jobs to the Treasure Coast.
Oh, boy. All right. Now, now we have a new emergency room opening and certainly senior care as well. But I know as a normal situation, too, Jim, I know you've been very much involved in this for years as far as the emergency room. What's the procedure right now for people checking in? Obviously, you have to prioritize, or what is it, triage?
Triage.
Yeah.
Well, currently what we have is when you walk into the ED, we have a electronic kiosk set up so that we can make for a rapid triage. And basically, the patient walks in, slides their driver's license, their name then appears on a tracker. So we, within seconds, know that we have somebody who's going to need treatment. At that time, we have a paramedic or an EMT who's sitting in that greeter station, pull them in, just very rapidly ask them, what's the problem? And once they ascertain what it is, they call the charge nurse, and then they're taken directly back to a bed. So their sliding of their driver's license or whatever card they have to designate their personal information will help us identify them. If they've been there before, it'll help us pull up their medical record, and we'll get them back to a treatment area, get a physician with them and a nurse right away. So we're seeing no waits in the ER. Our wait time is less than just a couple of minutes, and we're really proud of that. And we're going to carry that forward to the freestanding ER.
It's like a new emergency expansion kind of helps there, doesn't it?
Oh, it does. All private rooms, Charlie.
Yeah.
If you get a chance to come by and see it, we'd appreciate it, and be glad to give you a tour of it. But it's definitely a state-of-the-art emergency department. We have something there we like to brag about. It's called Wally. I think we might have talked about him the last time. He's our robot that we use for neurotelemetry medicine, and he's quite fancy guy. When the neurosurgeon or neurologist can't be there, we roll Wally to the bedside, and the neurosurgeon or neurologist remotes in and actually operates the robot to examine the patient and make decisions on whether or not the patient will require the drug called TPA. And I think we were just beginning to talk about that the last time I was here. So that's in full swing.
You're up and running
now.
with it then, huh? Yeah.
It's very nice, very state-of-the-art.
Now, in case I missed something, how many beds actually now do we have in emergency room?
35 now.
That's the 30. Okay, you mentioned
yeah.
that at the top of the show. So, and that's how many added now since Last time
we're up from 24.
20, yeah, that's what it was. Yeah,
to 35. And the big distinction there, what Jim was mentioning, is that all private, very accessible. It's a very open floor plan. So really, when you walk in, the lighting to the overall decor of it really, really is a good center. So I hope you never need us.
Yeah.
But in the event you do, we have a great facility just minutes away.
I know that the people have gone to the emergency room. I know it's arduous sometimes, because they think like they're sitting and waiting. But as far as the emergency personnel, they take care of what they take care of quickly. But, you're dealing in a situation where you have to wait for the patient's doctors to respond and provide direction too. And that's actually where a lot of the time is taken up. So
we now have a little program. It's called Informer. And when you come into the emergency room, we can give you a little account number and put it into your telephone, a smartphone, and you text in the word Informer 5 and then this account number. And now what you can do, and you're allowed to broadcast this out to up to 5 people, but it will tell you your entire stay in the ER. It will say, Charlie, you're in room 7. Charlie, Dr. Smith is your doctor. Jim Kruger is your nurse. We're drawing your labs. Expect another 30 minutes before the x-ray comes back red. So you're getting that information live while you're sitting there waiting, but you can also send it out to your family and friends so they know what's going on. And we really particularly like this for the adult that comes in with a sick child. And the dad is down in West Palm, the kid's got a fever. Mom can put that information in and send it off to dad, and he can be resting assured that the child's getting good care. He doesn't have to rush to get there.
Fantastic. All right. Well, that's the technology just keeps moving along, and so it's interesting. Privacy is one thing, but when you want to let people know, that's the way let the right people know.
Exactly.
So, and how it progresses from that standpoint as well too.
Exactly.
So St. Lucie Medical Center and new ER, expansion of ER, and of course seniors are certainly getting a lot more of attention now. Always did, but even more so now because you're more geared toward seniors, and so they are getting excellent attention at St. Lucie Medical Center. Well, we're enjoying our time now with Jyric Sims, who is the Chief Operating Officer, Assistant Vice President for Nursing, Jim Kruger, on Treasure Coast Health Week, and so we are going to take a time out here and find out what's going on around the state of Florida here on Treasure Coast Health Week, and then we'll return with more Treasure Coast Health Week brought to you by St. Lucie Medical Center. Lots more to talk about as to what's going on at the hospital. And so, again, we appreciate Jyric Sims and Jim Kruger for being with us this morning on a live edition of Treasure Coast Health Week. But then again, we're going to take a time out. We'll be back with more. Stay with us.